So thank you all for being here. My name's Emily Ann Ball. I'm the Executive Director of Resilient Georgia. And I think most of you know, but we've been around just over 3 years. We had our birthday this summer. And one of our largest, biggest, most proud program is our regional partnerships with all of the panelists today. So right now we have grown greatly since we got started. We're now covering 120 different counties. We have over 900 stakeholders, all of you here today and many others. And we're just super excited to have our presenters today from rounds 1 and 3 of our regional partnership program present to you. So they were tasked with something very difficult. They have 8 minutes to share their one big idea. So there's a ton of information that each of these very talented individuals and a ton of work that they've been doing over the last 2.5 years. And we want to definitely get that information to you as well. So we're putting a link in the chat. If you want to read more about their work, please do. Again, today they're going to present their one big idea, but there's so much more work behind what they're presenting today. So we are very, very proud. With that, I would like to just remind everyone, if you are not tuned in to our updates, please log on to our website and you will be invited to all of our big general meetings. Our next one, where we'll hear from rounds 2 and 4, will be held in December. We'll get that invite to you soon, and as well as all of our newsletters, and please follow us on social media and all that good stuff. So I thank you again very much for being here. And to get started, next slide, Audrey. We are going to start talking about some different projects about bringing partners together. And we're going to start with Resilient Gwinnett and Kamisha Walker she's the Community Health Program Manager from the Gwinnett Coalition.
Hi, excuse me. Hi, good morning, everyone. As Emily Ann stated, I am the Community Health Program Manager for Resilient Gwinnett. I want to first thank Resilient Georgia and also Emily Ann for the opportunity to present on behalf of the coalition and to be able to share some of our hard work here in Gwinnett. You can move to the next slide. All right, so to give a little background into our organization, the Gwinnett Coalition was founded in 1991, and through its evolution focuses on strategically aligning leadership, resources, and systems that foster equity for Gwinnetians through the collective impact model, where we serve as the backbone organization. Aligning with Resilient Georgia, the coalition branded our program as Resilient Gwinnett, where we created 3 goals. So the first goal is to increase community awareness about positive and adverse childhood experiences and related topics. The second goal is building capacity with trainings throughout the community. And we're doing that through a training partnership with a local organization called GUIDE. And GUIDE stands for Gwinnett United in Drug Education. And our third goal is to influence systems change for an integrated behavioral system of care for individuals 0 through 26 years of age. You can move to the next slide. So, as we all know, the pandemic and its prolonged effects have highlighted and exacerbated inequities among Gwinnett's residents, and children often endure the most of those inequities. The coalition recognized this dilemma and decided to create the PACES Roundtable to convene other public and private stakeholders who are responsible for the health, safety, and education of children here in Gwinnett County, and to explore community response at the systems level. So some of those stakeholders include the director of Gwinnett County DFACS, the superintendent of Gwinnett County Public Schools, as well as the CEO of the Gwinnett Newton Rockdale Public Health Department. You can move to the next slide. Okay, so some of the objectives for our roundtable include assessing the current condition of children and youth relative to key resiliency factors, identifying strengths and gaps in ACEs prevention, as well as identifying the strengths and gaps in response to ACEs disclosures, exploring opportunities for service enhancement through policy changes, interagency communication and approaches, and then connecting with the coalition's healthcare roundtables for intersectional support. Next slide. Okay, so this year our accomplishments include in Q1, we had our initial meeting, which was held in January, where we introduced the group to Resilient Georgia, gave an overview of Resilient Gwinnett and what we were looking to do for the PACES Roundtable. It was decided to have the first meeting at a neutral location to foster a sense of familiarity and trust among the group. In our second quarter, our COO created independent exercises for each member to complete within their organization. The purpose of the exercises were to have a visual representation of where we were strong as a community and where more work should be done in relation to ACEs prevention and resiliency factors. For the ACEs and resiliency factors we listed in the exercise, members had to determine whether their organizations were emerging, established, or leading in that particular area. If they listed themselves as emerging, then that means they are currently in the beginning and planning process in trying to tackle that ACE. If they are established, then they're currently doing the work in their organization. If they labeled themselves as leading in that particular area, that means not only are they doing the work internally in their organization, they're also influencing others as well. Now, this wasn't a comprehensive list of all factors, but gave the group a starting point to build from. We held those exercise briefings via Zoom, where we explained the purpose of the exercise and how to complete it. So in Q3, we held our second in-person meeting where we reviewed the results from the exercise and then discussed the results within the group. Next slide. So after reviewing the results from the exercises, so far the group's initial impressions are that Gwinnett embraces collaboration versus competition. So we're all very eager to collab and work together and combine all our resources. We also realized that we do have successful existing programs within the community. Based on the results from the exercises, there were a significant amount of established and leading ratings in ACEs prevention and in some of the resiliency factors. So after that, we also realized that we do have adequate funding to help assist with those efforts. Now, some of the gaps that we saw was the organizational capacity to receive trainings. It was pointed out that some organizations have a challenging time with participating in the trainings due to managing day-to-day workflow, staffing challenges, and increased service requests. We also noticed there is a lack of a 24-hour mental health crisis center here in Gwinnett, and prevention measures and support for incarcerated individuals and their families, maternal depression, homelessness, and a focus on the LGBTQIA community here. Next slide. So for the roundtable's next steps, after the second meeting, everyone agreed that in order to accurately determine the need, more research and data gathering is needed. While we have anecdotal experience based on what we encounter on the job, we want to make sure that our efforts are data-driven. Once we analyze that data, we can begin expanding the group based on the need that we see. The group discussed adding someone from the local judiciary system, as well as having some representation in maternal health. After we add 1 or 2 more members, then we'll start to create a strategic plan, and then goals focus on moving the needle towards improving those gaps from our research and then from the exercises. Next slide. All right, so we're here at the interactive portion. So for this part, I would like everyone to take a look at the ACEs chart, and then in the chat, since it looks like the chat is fixed, if you can list the ACEs that your organization is currently working on. And then just as a follow-up question, just to ask yourself, or if you feel comfortable putting it in the chat, what strengths does my organization have in preventing these ACEs that you guys are working on in your organization? What gaps exist? And then what are your potential next steps? So once again, thank you to Resilient Georgia and Emily Ann for the opportunity to present to you guys. Thank you.
Thank you, Kamisha. And I should mention, Kamisha's only been in her position a few weeks, and she has started sprinting since getting there. And we're so proud of all.
3 months as of yesterday.
All right, 3 months. You've got some time, but thank you, Kamisha.
Thank you.
Next, we're going to hear from one of our round one regional partners who's been with Resilient Georgia since I think the very first day we met as an organization. Lizanne Roberts is the executive director of the Coastal Georgia Indicators Coalition, and she's with Resilient Coastal Georgia. She's going to be talking about Handle with Care.
Good morning, everyone, and thank you, Emily Ann, for the introduction and just the great work that Resilient Georgia does. We appreciate the opportunity to share what we're doing in the coastal region. On the next slide, you'll see our collective impact project. Coastal Georgia Indicators Coalition is the organization I serve as a director. We're the backbone organization for our collective impact initiative. You'll see that we cover several areas in the community. We have a school-based work group that has 38 members that are working on what it looks like to be a resilient school. And that includes mindfulness zones and programming and training for staff, that kind of thing. And then the out-of-school network includes Parks and Recs, the library system, faith-based communities, and others that are interacting with children and families. And their work is centered around toolkits and trainings for those different groups. It also includes early learning providers. Our third group are judicial. If you could go back to the previous slide, great, thank you. The judicial and first responder group that has all of our first responding agencies and our juvenile court and superior court members. We also are working with 14 counties, including Chatham, so 13 counties in our region, plus a regional manager around the implementation of Handle with Care. We also have a steering committee, and our steering committee has 41 members, and we meet every other month to talk about the direction of the initiative and get their feedback and share information with each other. Next slide. This morning, I want to focus in on Handle with Care. To say that I'm an advocate for Handle with Care is an understatement. I've seen the impacts of this in our community, and I really want every community in our state to embrace this notion of this systems change. For those of you who are new to this idea of Handle with Care, it's a notification system where when a first responder, be it law enforcement or EMS or fire, interface with a family, or even they're in a neighborhood where there has been a child that's been exposed to a traumatic event, they use a notification system that shares just primary information with the school system to notify the school system that the child has experienced a traumatic event. The information that's shared is the child's name, their age, the school they attend, and the words Handle with Care. In Chatham, this is done through an app that the first responders have on their phone or their tablet. It's very easy for them to put in a Handle with Care notification. Once that notification comes in, staff and school personnel are notified. They observe the child to see if extra support is needed. And then they intervene if the child's behavior starts to escalate, and they get the child into the needed services to help them with the trauma that they may have experienced. So we've implemented this in Chatham, and I am so glad to report this morning that we have regional partners who are engaging with us in this process. So on the next slide, you'll see our region. The darkest blue are the counties that are implementing Handle with Care. These include Bacon County, Chatham, and Effingham. Currently, the next shade of blue are those counties that are in the process of finalizing MOUs. Those include Brantley, Bryan, Glenn, and Ware. And finally, the very lightest color are where they are in discussions, and those include Camden, Charlton, Liberty, Long, McIntosh, and Pierce. We are pushing to be the first region in our state to have Handle with Care implementation. So we are excited about that, and we're challenging other regions to come alongside us and work towards this implementation. So the big questions that are before us are, would you like to see Handle with Care implemented statewide in Georgia? And if so, what are the crucial conversations that need to be had in your community to move Handle with Care forward? What does that look like for you? And how do we continue to move forward in the implementation of this statewide so that we can help children on the front end of when they experience trauma? I want to thank the Region 12 Family Connection partnerships, because they are the ones that are driving the conversation in these counties. Finally, on the last slide, our mission is to transform our communities from hurting to healing by building a trauma-resilient region. Please reach out to me if I can be of any assistance and share the information regarding Handle with Care. Thank you.
Thank you, Lizanne. I saw lots and lots of good questions for you, so you may be busy in the next couple of days responding to all those, but thank you for the wonderful presentation. Now we're going to hear from two of our regions that have been working with youth a lot. So our next segment is engaging and empowering youth. First, we will hear from Greater Valdosta United Way, and Michael Smith is their executive director, and he has done so much in a very short time. Michael, I will turn it over to you.
Oh, hello, thank you very much. I'm very excited to be here and being able to speak about what we're doing at the Greater Valdosta United Way. We partner with 20 local nonprofits and cover 10 counties, but with the Resilient Georgia grant, we're covering 8 counties for mental health focus. I'm also the current chair of the United Way of Georgia's Association. There's 32 United Ways around Georgia doing great work and connecting and having impact in their local areas. Our biggest thing is really just focusing on what is ACEs and bringing information into South Georgia about mental health, trainings and opportunities to have people take their mental health serious. Our campaign is It's Okay to Not Be Okay. And one way we're focusing on that has to talking to schools and youth, especially minority youth, males. And one way that's great to do that is through sports icons and celebrities to speak and connect. Our coalition partners, Boys and Girls Club, Children Advocacy Center, Family Connections, the mayor of Valdosta, Russ Goodman, he's state senator, District 8, Vince Miller, Dean of Students at BSU, and also involved with Moody Air Force Base and what they're doing with mental health in the Air Force. So we had a great sports mental health takeover. As you can see, we had some celebrities come in, Jermaine Jones, Lamar Odom, Anthony Smith, Otis Nixon, and Quincy Carter. They all talked about experiences they had as youth and adults and things that led to depression, alcohol abuse, just things that they experienced as a child that they didn't really think about until they were older in their careers and how it affected their lives and families. And we had a panel with current BSU coach and high school coaches and professionals. And then we had a sports camp. Next slide. So it was a 2-day event, the symposium for mental health, then sports camps for youth of basketball and football, and then a celebrity game. That's me and the right shooting and playing in it. I was very sore after that game, but we had over 300 people there. It was a great weekend to just talk openly about issues affecting especially minority youth in communities, and bringing mental health to the forefront. And I'm really proud of what our region's doing of taking mental health seriously, talking suicide prevention. We've had a good bit of suicides and attempts in our area, along with first responder training and the mental health resource guide that Resilient Georgia has helped us create, because there's not a lot of resources in South Georgia, and we also don't have 211. So it's hard for people to find the mental health and just the human services, essential services that people need in South Georgia in the area. So we've also, next slide, tying in with that, this is all of our sponsors for the mental health takeover. We had great media coverage, TV, radio, social media, podcasts, newspapers. We have billboards running about mental health and taking your mental health serious throughout the area too. Next slide. Here's some pictures from the event. The turnout was great. We even had some local therapists and professionals there to set up, to give out information so that people could sign up for visits or just understand the numbers to call for emergency and help if you need. Next slide. And another partnership has been with Adrian Peterson, NFL star and a college football Hall of Famer that played at Georgia Southern, not the one from Oklahoma, but the one that played at Georgia Southern, still holds records for rushing yards and touchdowns scored in college. And we've had him go around and talk. He has overcome his speech disability and the embarrassment of that when he was younger, and worked hard to overcome, and understands bullying and effects of mental health. He also is the player development coach at Georgia Southern for the football program. So we really can talk about what these kids coming from COVID and what social media is doing to these young athletes that are starting their college career and high school athletes. And so we've taken them all around the area, spoken to elementary and high schools and Boys and Girls Club over multiple counties. And then we have our second annual mental health awareness night taking place next week with Trey Battle, a former UGA star and Dallas Cowboy football player, that if you Google it on YouTube, there's a video where after his football career, he was very close to committing suicide. He was on the bridge and called Mark Rick, his former coach, and the coach said, "Get to my house, we'll talk," and really saved his life and talked him off the ledge. A lot of people go through things. Connecting with these professional athletes are so important. You see them on TV, you know them, you think they have their life together and everything's perfect. They have money and fame, but they still have struggles and depression and anxiety and issues, and just connecting with kids and talking about that and bringing that openness to have those trusted conversations. Who was your childhood hero? We all have them from different, whether sports or actors and different people. Mine was Bo Jackson and Will Clark, two superstars back in the day in football, baseball. So that's what we're doing, and just informing people about ACEs, compassion fatigue, trauma-informed care, and just making it an open environment to have those tough conversations about people's mental health, which ties right into your physical health and well-being. Is there another slide? Yes, here's some other pictures from some of the events. One of the best has been Adrian Peterson also talking to the school counselors and the coaches at these schools. We've tried to line up lunches. Talking to the kids have been great, but when he interacts with the counselors, he can really give them that deeper dive information and then share professionally what they're seeing. Really also tied in with social media and the bullying that goes on, and just the demand of the social media that these kids are involved in, and seeing how that affects their mental health.
Thank you so much, Michael. And Michael's been teaching all of us more about the culture in his community, and it's been so fun to see how you've embraced it. And when football is king, that's what you've done. It's really
Thank
highlighted.
y'all for y'all's partnership and everything y'all do, and just bringing resources and information into South Georgia, because we lack a lot of that, especially in the mental health side.
Thank you. Next, we are going to be hearing from Resilient Communities of East Georgia and all about the Resilient Teens program from Dr. Kim Loomer. She is the Associate Dean, a professor of Psychiatry and Health Behavior at the Medical College of Georgia. And Kim has also been with us from the start and just a wonderful human to be around. So Kim.
Great. Good morning, everyone. We can go, here we go. We'll start with last year we had the opportunity to go through a mission, vision, and values, and that was a critical process for us. So we want to create a network of leaders trained on building resiliency around our community. Our catchment area is 14 counties. Our most prolific partner is Family Connection, and that has been a wonderful partnership for us from day one. And I think Julie Miller's on the call, and she's our number one community partner. We've had a lot of other partners on our advisory committee, but Family Connection's been there with us from the beginning and has really been a wonderful partner in the process. So you can see our mission, vision, and values, and we can go to the next slide. So I'll talk a little bit about how we started. When the grant proposals were due for us in 2019, this was pre-pandemic, we noticed a 500% increase in adolescent suicidal attempts, completed suicides, or ideation, and there had been a 500% increase in the local emergency rooms. So after looking at the data, we decided to be very laser focused on teen mental health. And as it's turned out, all of us are realizing that we're seeing that as an increased need post-pandemic or endemic, whichever we're in right now. To date, we have had 5 cohorts of teens participate in a program called Resilient Teens. The program is a large group setting, and they learn a little bit about resilient skills and resiliency building, and then they go into small groups. The small groups are facilitated by medical students here at the Medical College of Georgia. And so far, we've had over 90, closer to 100 medical school facilitators. The other pieces that we've worked on, because we started real specific, we've now broadened our focus, whereas I think a lot of the other coalitions may have started the other direction. So we're catching up in that regard. We have focused this year on expanding our coalitions. And so making sure that the Resilient Georgia Training Roadmap is truly covered in our advisory council, as well as the folks with whom we interact and train and collaborate. The other new piece for us this year was our Family Connection. We have 2 coordinators of the 14 counties that are leading their colleagues to create summer programs of resilient teens. So it's more like a summer camp. It's about a week long, and it's just more of a taste test of resilient teens over the summer. We are going into our 2nd annual summit. We're really grateful. Emily Ann will be there to talk a little bit about the work at Resilient Georgia. That's going to be September 29th, and I'll say more about that in a few minutes. As we said, we've expanded the sectors. We've also hired a company that's worked with us on the marketing and the fundraiser. And we had a community leadership group, Columbia County Leadership, that decided to do a golf outing and raise money for us. They heard about our project and thought we were great, I guess. So we were pretty excited about that. We're also working with the other sectors in our community to increase the training collaborations to make sure if Connections Matter, Darkness to Light, Christie Campus, QPR suicide prevention training, that we are helping people get connected with those different types of training. Some new endeavors we have for this upcoming 6 months to a year. We have a unique building in Augusta called The Hub, and it hosts a literacy center, a family health care clinic. It hosts Augusta Locally Grown, which brings the farmers market to an urban food desert. And in that space, they have donated to us a food pharmacy that we're really excited about. Our family medicine department here at our medical center is we're going to pilot this program in the spring. And so patients that have an A1C level over 8 or are already diagnosed with diabetes and they're self-pay or Medicaid will get referred to the food pharmacy. We'll have a full-time nutritionist there. Our medical students will eventually rotate through there, but they will run it as a student-run clinic. And the patient and up to 3 family members in their household will be able to get fresh fruits and vegetables that we purchase from the farmers, and also shelf-stable food from our local food bank. So we're feeling excited about that. We are also, another new endeavor is a licensed curriculum. So we're working with an instructional designer to basically be able to drop ship our Resilient Teens curriculum to other organizations, other medical schools, and then to create a portal and some licensure where we could update that and monetize and offset our grant funding a little bit to ensure the sustainability of the program. So with that, I would like to ask in the chat, our interaction is, list what you believe to be the biggest issue on the mind of teens today. We're getting some really great comments in the chat. Great comments. So information overload. I'm seeing and hearing acceptance, peer pressure, trauma gang, safety, school safety, social media, a lot of suicide and suicidal ideation, bullying, and I think the belonging, absolutely. So I will go forward. I appreciate your comments. And someone said, what have you all found? So I'll talk a little bit about that. Next slide, please. So what we do is an 8-week program. As I said, we have a large group and then small group breakout sessions where there are 2 med students who facilitate a small group of teens. Our teens range from 13 to 19. Most of them are living with family members. We've had a couple who have been in the youth detention center who've participated. And so juvenile justice is another sector that we're hoping to engage a little bit more. One of our school systems is interested in putting it into their health curriculum, which would be exciting. But 94% of our teens who've participated enjoyed the program as a whole and said they would recommend it to other teens. When we asked them about what the program helped them to do, They said it helped them understand and feel more comfortable talking about depression, anxiety, and suicide. They also indicated they're more aware of the availability of community resources and where to find them. 94%, that was a popular number this time, said they now better understand ways to care for their mental health. Interestingly enough, the same thing that our group talked about in the chat are things that our teens said. They talked about belongingness. They talked about social media bullying. They talked about safety in their communities, as well as substance abuse, gangs, drugs, and just trying to figure out, what do I want to be when I grow up? And I think one of the things we've found with the medical students serving as facilitators is that that has been almost a near peer model, where these are other young people. Julie and I and Melissa, are my two partners on this, are awesome, but we're not cool for the 13 to 19-year-olds. The medical students are. And so we think that near peer age group has been very successful. Next model, please, or next slide, sorry. What I want to do, I'm going to mute myself, and I think Audrey's going to help us with the link to the video, which will tell you a little bit about our summit that we would love you to visit. If that's not possible, I can, in the interest of time, just go back to the slide set. Almost possible.
I think it will be possible.
Thank you. Our last slide that contained the link to the video also has the QR code for our summit, and we hope that you will attend. And also, Doug Jackson and Donna Barrett, I am happy to talk with both of you and appreciate the reach out. Thank you for your time.
Thank you so much. Thank you so much, Dr. Loomer. Sorry about that, but I'm so glad your video did play. So next, we're going to be hearing a little bit more about providing vital information and resources to communities. And to start off, we'll hear from the Cobb Collaborative and Kaylee Rollerson, who's the program director at the Cobb Collaborative. And she's going to talk about some communications work that she's been doing, multi-layered and bilingual communication strategy. And Kaylee has also not been in her role terribly long and started out sprinting and has done just amazing things with the Cobb Collaborative. Kaylee?
Thank you so much for the introduction, Emily Ann. We're just so grateful to be doing this work alongside you guys. So we're thankful. As she said, my name is Kaylee Rollerson. I am the program director with the Cobb Collaborative, and we are the Georgia Family Connection partner serving Cobb. So we work to educate, engage, and empower local people and organizations with the hopes of improving outcomes for children and families all across our community. We do this through three main initiatives: civic engagement, literacy, and mental health, of course, which is why we are here today. And so just to open us up, and feel free to put these answers in the chat, what communication outlets are you all seeking to gather information? All right. I'm seeing social media, podcasts, webinars, news apps, NPR. Yeah, lots of good ones coming through. And so what we're seeing here are some common themes and how people prefer to receive communication. And we really wanted to go with a very robust communication plan because we know people have different preferences and different needs as they're seeking out information. We wanted to meet people where they are, be in the places that they are seeking out information already. So it was important for us to be equitable and make our communications more accessible and reflective of the community in which we're serving. So you'll see most of our communication materials are bilingual. We, in addition to this, to serve our large senior population, we have digital resources, but we have print as well, as we know people have different capacities for absorbing information and different preferences. So what you will see on the slide here, first up is our digital toolkit. So this toolkit is divided into three main sections. We have a general overview of mental health, ACEs, and suicide prevention and awareness. It's filled with printable resources and social media images, Cobb County data, and resources in and around our community for people in a variety of different circumstances. So if they're insured, uninsured, underinsured, how you go about finding service and getting access to service is going to look different for each of those circumstances. We know finding a mental health care provider can be just a really daunting and overwhelming task. And so the idea here with this toolkit is to alleviate some of that burden on those who are seeking assistance and provide that one-stop shop for information and trusted resources. This is available in both English and Spanish, and we've had people pop into the office even to see if we had some printed versions of it. So we have that now as well. We know that there are many online resources available, but we felt it was important to curate a resource specific to our community. And then lastly, this is not a static tool. So this is something that we are updating on a quarterly basis as we come across new resources in our community. Next slide, please. So following the trend of our toolkit, we have some targeted communication posts on mental health, ACEs, and suicide prevention. This was, you'll see on the slide here, was our ACEs campaign that we launched on social media. And this campaign's purpose was to increase awareness and prevention measures for adverse childhood experiences in Cobb. So this campaign, along with some of our other campaigns, ran in both English and Spanish, again, just to further that reach and provide more equitable access to the information provided. So we're excited to say our social media reach has become, it has grown, it's quite expansive. And so I did just a little total on the stats here. Our total Facebook reach for mental health, ACEs, and suicide prevention was 68,741 people. And our total Instagram reach was 25,209 people. So we see that although our main focus is Cobb, we've reached beyond that through social media, which is wonderful. We know that this is a main source for information gathering, especially for our tweens and teens and 20-somethings. Next slide, please. So our podcast is an effort to have deeper conversations with many versatile community partners in the field of mental health. We've spoken with social workers, nonprofit directors and founders, and more. These community partners are serving many people with many different experiences. For example, people who are uninsured, underinsured, people with disabilities, people who may be walking through addiction, and people serving our Spanish-speaking population. Our partners are also serving a variety of ages. So we've got partners that are serving our littlest ones and our teens all the way through our aging population. So as we continue to delve into conversations with subject matter experts, we hope to increase our capacity for equity, as well as our audience's capacity for equity. We hope people will walk away with increased knowledge of resources available in our community. And of course, with this being a podcast, it caters to those of you who have a preference or a need to consume your information audibly. So I saw y'all in the chat who like to listen to your podcast and your NPRs and all of that. So Audrey should be dropping a link to our podcast in the chat. So make sure you check that out. And next up, we've got our newsletter. So you can move on forward to the next slide. Sorry about that, Audrey. So for the majority of the months throughout the year, we focus on some thematic element or specific population and how mental health affects that population. We want to provide supportive and culturally competent resources to support them and ways that we can better serve them in the field of mental health. So on average, since the start of the year, this is getting about 560 viewers per month. And we hope for this to be a support to those who may need resources themselves, or to support organizations doing that people-facing work. And of course, all of our member organizations who are a part. Next slide, please. We've got our Mind Your Mind mental health page on our website, and it is available in both English and Spanish. And then the drop-down tabs for ACEs and suicide awareness and prevention are also available in both English and Spanish. As you scan the page, you will find a plethora of resources for people of all different ages, walks of life, experiences, and specific circumstances. And so again, just working to eliminate as many barriers as possible for those who may be searching out mental health support. And last up, because I know my time is coming to a close, one important aspect of communications is branding. And so while a logo does not encompass all aspects of creating a brand identity, it is a large part of it. This creates a strong identity and awareness across the community. So no matter what form of communication we happen to be utilizing, there's a recognition there. So you'll find our Mind Your Mind stamp on all of our mental health communications. And so hopefully when people see this stamp, they will automatically know what to expect from that material. It helps create a relationship between the initiative and the people who are being reached. And in addition to this, it was important for us to choose an initiative name that would translate well in Spanish. So we worked collaboratively with a Latin serving organization to ensure that the translation of Mind Your Mind worked before we officially adopted it. So while these are not our only forms of communication, this is a pretty decent overview of what we have going on. You'll also hear from us periodically in blogs and in press releases, among other things. But we are always seeking out ways to grow in our capacity to be as robust and equitable in our communications strategies and outlets as we possibly can. So as you all check out those links, we would love to hear from you and how we can continue to expand, improve, and meet the communication needs of our community as best as we possibly can. Thank you all.
Thank you so much, Kaylee. You have so many accolades in the chat, so you're going to be busy responding as well.
Thanks, everyone.
Next, we are going to hear from Resilient Middle Georgia and some of their work about communities and schools. And I'm excited to introduce Dr. Andrea Meyer-Stinson. She has also been with us from the start and was actually one of our founding board members. So we're very, very thrilled that we've been able to continue to part with her and her team in Resilient Middle Georgia.
Hi, hope you can all hear me. Thanks for coming today, and thanks Emily Ann and Lynn and all the others at Resilient Georgia for this opportunity. We are Resilient Middle Georgia, and next slide, please. So a little bit about who we are first. We originally started with two creators, I guess you could say, of Resilient Middle Georgia. That's Jill Vanderhoek, who's the Executive Director of Community Partnership at County Family Connections, and myself. We have now been in this process of doing this work a little over 2.5 years. And so in our second round of funding, we were able to support a project coordinator, Amanda Juarez. And each summer, we also hire a medical student to do summer scholars work with us. So this year, our summer scholar is Ariana Borges. Next slide. So a little bit about Resilient Middle Georgia. We are in Middle Georgia or Central Georgia. We focus on 14 counties with the seat in Bibb County. We hope to inspire long-term healing, build resilience, and empower community champions to join the trauma-informed care movement. We want to empower the cities and counties in Middle Georgia to face adversity and trauma with empathy and bravery. And we're doing this through some goals you see at the bottom here, really informing our communities about PACEs, positive and adverse childhood experiences, building a common language, strengthening our networks of leaders, expanding our coalition, providing evidence-based training and resources, and empowering change from within the communities that we serve. Next slide. So we recently finished our year 3, I guess half year 3 report, which is located on the Resilient Georgia website. So in the last 6 months, here are some of our accomplishments. We've held 3 coalition meetings. We've screened the documentary Resilience 6 times in our communities. We've been part of 10 awareness events where we shared information and built connections. We have offered 11 evidence-based trainings to members of our community. We've engaged with 112 coalition members primarily through our coalition meetings. We have trained over 325 people in the last 6 months. We've also given out some materials to build awareness. We have resilience bags and emotion wheel magnets that we co-branded with communities and schools and Macon Mental Health Matters. So those are some of the accomplishments for the last 6 months. Next slide, please. So I want to talk a little bit about or highlight our relationship with communities and schools. And because I have a limited amount of time, I am going to read some from my notes to make sure I get all the important bits here. So we began this relationship actually in 2019 when we first had our award from Resilient Georgia. The CEO of Communities and Schools of Central Georgia came to our very first coalition meeting where we trained about 50 individuals in Connections Matter training. I saw Tiffany was here in the chat. She was there, part of that. So Communities and Schools, as part of both a statewide and national network, which focuses on building relationships that empower students to stay in school and succeed in life. At Communities and Schools, the focus is improving student and school success by providing needed support and services to those schools and the students, and therefore the families. The wraparound model has demonstrated the strongest reduction in dropout rates of any fully scaled dropout prevention model evaluated. Communities and Schools of Central Georgia really focuses on seeing the potential in every student, committing to helping them see their own potential, and providing whatever resources are needed to those students to help them thrive and flourish. Communities and Schools aligns very well with the mission and vision of Resilient Middle Georgia, and in that it is increasing positive childhood experiences, which are just as important as reducing adverse childhood experiences. They do this by providing support, expanding connections both within the school and in the community, increasing positive interactions with others, and offering a safe and consistent adult mentor relationship to children and adolescents. We have been having these conversations with Communities and Schools since the beginning. I think it's kind of like a marriage or a couple relationship where you have to just keep at it and be consistent and keep communicating with each other. And this has led to some really great opportunities. Really what we have focused on is increasing our intervention strength through partnerships with people like communities and schools. At first, we were able to train their initial empowerment coaches that they hired in Connections Matter. They had began hiring empowerment coaches for each school, which they have 12 schools that they serve. In the fall of 2021, we noted at a coalition meeting that there was an increased need for grief resources in Middle Georgia. So we partnered with Kate's Club and Communities and Schools to bring grief training to the empowerment coaches in those schools. We have, in preparation for this coming year, trained an additional group of empowerment coaches in Connections Matter. And really those coaches have been doing the work that we're all talking about for years. But what it has allowed them to do is really provide them a deeper understanding and added language around the experiences of the children and adolescents that they are serving. In addition, Resilient Middle Georgia has provided 27 copies of The Deepest Well, 14 copies of What Happened to You, which both have led to conversations, and then those resilience bags and emotion wheel magnets. Next slide, please. So while I'm presenting the next few slides, I want you to think about a question. Imagine you were in 7th grade again. I know it might be traumatic to do that, but take a moment to imagine you were in 7th grade. What would be on a vision board for you? How would you know, or how would knowing your vision for your future help you in your day-to-day interactions at school or at home? So I think we're going to drop that in the chat here in a minute. So Taryn Collinsworth is the CEO of Communities and Schools of Central Georgia. She states, we believe defining a mission and creating a visual representation of this vision allows our students to look towards the future. When combined with discussion, students are then more hopeful and resilient. Next slide, please. So Communities and Schools received funding from Resilient Middle Georgia to institute this Building Resilience by Defining Vision project. So far, 350 students in 6 schools have completed this challenge. An additional 400 will be completing it in this next academic year. Next slide. At Communities and Schools, all of the staff, which are the empowerment coaches, use this project funding to train themselves in what's called a vision challenge. And it was from the author and creator of the actual Vision Board Challenge project. And so you can see in these images, the empowerment coaches working together to learn more about how to do vision board implementation with youth in schools. Next slide, please. Once trained, the empowerment coaches implemented small group programming, engaging students in the process of defining a vision for their future. Students defined a vision in which their strengths are elevated and they can amplify steps towards their future goals. And this is the developer of the Vision Challenge, Tanya Coons. It is, I think, available online to be purchased. Next slide, please. Students then created a visual representation of their vision with the help and support of those empowerment coaches. You can see them working there in those pictures. We had to be mindful not to include student pictures, so these are empowerment coaches here. They are not middle schoolers, if you can't tell. The vision was really important, as was the process of creating it. It helps students to identify inherent positive and resilient qualities in themselves and build their overall resilience. Next slide. So here are a few examples of the vision boards that students created. It's important to think about. It's not just creating the vision boards. that makes a difference. What they're doing, the process of doing this work with a mentor, identifying strengths and envisioning a preferred future is really where the resilience building comes in. It's the connections they're making with each other and with their empowerment coaches and the connections to their strengths. And so the output is beautiful, but it's the process that's also important in this work. Next slide, please. So we are busy in Middle Georgia. Our focus for our year 3 and year 4 grant projects are really about emphasizing policy, systems, and environmental change. I was so happy to hear about Lizanne's success with Handle with Care, because I'm going to be giving her a call to say, what are you doing? Let's help me so we can do the same thing. But really what I want to emphasize is our partnership with KinShift. KinShift is an organization that provides trauma and resilience and anti-racist training to organizations and entities. We are working with KinShift over the next 6 months to offer in Middle Georgia a leadership collaborative in which our community champions will work together, meeting monthly, to talk about how do you really instill trauma-informed anti-racist principles into organizations. The goal here is sustainability and long-term change in our community. So we're doing that work in that way. We're also offering community resilience model train the trainer to our community members, working on some other projects that have been funded in Middle Georgia, and then hopefully Handle with Care will come along in that process. Next slide. And this is our contact information. Our program coordinator, Amanda Juarez, is here on this call. She did just start a few months ago, but she has jumped in and is ready to go. We're just really excited about all the amazing things folks are doing for Georgia, and working together is key. So if you need us, please reach out and we'll be here to help. Thanks, everybody.
Thank you so much, Andrea. The next section of our meeting is centering community needs and voices. So really taking time to hear from the community and listening to their voice. First, we're going to hear from Javon Gibson. He's a senior advisory at Community Health Solutions, and their coalition is Aligning Community Systems for Resilience Initiative, and they're out of Clayton County. So I will pass the microphone over to you, Javon.
Excellent. Thank you very much. Hopefully everyone can hear me well. It's good to hear from everyone today. And thank you so much. Next slide, please. So I want to talk to you today a little bit about our work in Clayton County. I'll start by sharing a quote with you that was said to me a number of years ago by Dr. David Satcher. Dr. Satcher said that if a system consistently produces the same output, then that system is designed to produce that output. I'll say it again. If a system consistently produces the same output, then that system is designed to produce that output. Our work with the Aligning Community Systems for Resilience Initiative, it would be affectionately called CSIRI, really began with thinking about the community that we were in. As you heard, we are in Clayton County, Georgia. I'll tell you a little bit about Clayton County. Clayton County is 70% African-American, roughly 13%, 70% African-American, roughly 14% Hispanic. Almost 20% of the population lives below the poverty line, and roughly 300,000+ residents. Next slide. So for Aligning Community Systems, as Dr. Satcher said, many times when we look at trauma, and trauma that is endemic in these communities, we recognize that it's intergenerational and it's contextual. Well, essentially what we mean by that is it's been going on for a long, long time. It's become a part of the community, and there are multiple factors that are informing that. So Aligning Community Systems really is a name given to what we call a cross-sector engagement strategy. What we believe as an organization that is Community Health Solutions and our partners at Georgia Campaign for Adolescent Power and Potential was that to properly respond to the systemic and complex intersection of all these multiple sort of traumatic things that were informing the health outcomes of youth and families in Clayton, that we must provide a cross-sector strategy, and we must engage multiple systems and try to find ways to incorporate systemic approaches into this strategy. Now, before I go to the next slide, I want to ask you a question. I just told you what the population looked like, and I told you we're doing a cross-sector engagement strategy. I've seen a number of you engaging in a number of different sectors. I want to hear from you, given the population and what we're trying to do, what systems or sectors would you engage in order to begin the dialogue around ACEs and adverse childhood experiences? Drop it in the chat for me. Not everybody at one time. I'm trying to see, am I not seeing it? Okay. So nobody has systems or sectors that they would engage? Or is it just that I can't see them?
I think you can't see it. The chat's blowing up. Lots of people are
okay.
talking to you.
There it is. So I'm going to assume that you guys got them right, because clearly I can't see them. But maybe someone can tell me some of the examples that were said.
We've got a lot of good ones. Barbershops, out of school time, early childhood, faith, schools, civic groups, parent
Awesome.
involvement. Yeah, we're ran the gamut.
Awesome. So that's indicative of the fact that I'm on the line with a bunch of experts. Next slide, please. So our approach to this process was pretty simple. First of all, what we recognized was that Clayton County is unique in that the county in and of itself had been exposed to the concept of adverse childhood experiences. Having worked in Clayton now for probably 10 or 11 years off and on, and having done probably, I don't know, 7 or 8 multi-year grant programs there, one of the things that you will know is that it's on the map nationally. I've got calls from multiple organizations from all across the country trying to find inroads into either Clayton County Public Schools and it's because, I mean, you have 90+% of the schools are free and reduced lunch. I mean, it's a complex intersection of issues. But what's interesting about it is because there are so many organizations that are trying to get into the community, the community has become somewhat desensitized to this idea that you want to help. And recognizing that the community is desensitized, we knew that we had to develop a different approach. The family connections model in Clayton County is not quite as evolved as some of the other family connections. They use a slightly different strategy. And some of the partnerships are there. The county was used to coming together around different issues, but they weren't used to staying together, and they were sort of more tired of coming together just for the sake of conversation. So we had to take all that into consideration. So in the nascent stages of our work, what we decided to do was use a more traditional approach that seemed to work well across other programs that we've had, whereby we engaged servant leaders and trusted messengers. Now, here's what's a little bit different from sort of just a collective impact model by engaging servant leaders and trusted messengers. And it's slightly different in that in some instances, our servant leaders were systems leaders. But in other instances, our servant leaders and trusted messengers were just people that we knew that their voice carried weight and gravity with the target population. And when working with a largely minority population, those voices matter. It can be somewhat complex, the relationship they have with servant leaders. So we engaged a pastor who had amazing relationships in both government and other sectors. We engaged a couple of other folks that I knew from my work in the community and said, hey, listen, can you find people with like minds around this work? And we spent some time sort of talking about what does this trauma conversation look like? And so we then decided, okay, we really want to raise awareness of ACEs. We want to raise awareness of trauma, but we wanted to do it in the context of what is the lived experience of the people that we're working with. Well, what does that mean? It means that while we're talking about trauma, we have to talk about things like structural and contextual racism. We got to talk about daily microaggressions. We got to talk about things like systemic racism and all those factors. And we have to create a space where we're confident having those conversations. One of the things that we also had to take into consideration that within our community, even when we talk about things like child abuse, child sexual abuse, and other ACEs, there is what we call a culture of silence. As a general proposition, these things happen and occur with some degree of frequency, and a part of our own sort of internal resilience struggle is to suppress sometimes these experiences and not find ways to address them. So creating safe spaces, what we call kitchen table conversations, was what we needed to do in order to really set the stage for where we were going. We had kitchen table conversations with a number of different leaders. We had representatives from school system. We had representatives from the police department. We had faith leaders represented there. And to set the stage, we said, hey, listen, this is what we want to talk about. We know it's not something that everybody's super excited to hear. We know the dialogue is taking place, but we also know that we need to find a way to break this culture of silence. We then moved away from that, forming sort of a quasi-coalition and deciding that we would set our target on raising awareness of ACEs and the structural and contextual factors that inform ACEs outcomes in Clayton County, and that we would also promote training and capacity building, specifically around Darkness to Light, the Stewards of Children's Darkness to Light and Connections Matter. And we just recently did a community resilience model training last week with some folks from Rainbow House, a bunch of therapists, and some direct service providers, with the understanding that, if we are truly going to do systems work, we need to have people who can support that effort. Lastly, what we are hoping, and the mantra was, at the end of all of this, what we hope to see is that stakeholders are engaged, that everyone understands the message, and that each sector, embedded in each sector, is a comprehensive training model to prepare so that, as a general proposition, the entire county is ready to prevent childhood trauma. Next slide, please. So this is an example of the sectors that we're working with. And apparently you guys hit on all of them. We engage government, we engage the faith community, we engage business and civic organizations, and we engage nonprofits. And of course, the rationale was simply, how do we reach people where they live, work, learn, play, and worship? And more importantly, what will give us the greatest impact and identify those populations that where ACEs were most prevalent. If you look to the right, you see the picture from our first launch. I probably should have included a couple of more from subsequent meetings, but that's a shot of our coalition members at our first launch meeting. Next slide, please. So here are the sectors within the subsectors within those areas that we are really targeting: youth serving organizations, the Clayton County Juvenile Courts, schools and educational institutions, and the faith-based community. You'll notice that the faith-based community is highlighted, and I'll talk a little bit about that more in a minute. But in terms of youth serving organizations, we engaged the Rainbow House and the leadership of the Rainbow House to begin, because they provide direct services to a very vulnerable population. And we also invited them to be on our board, on our coalition. And so they helped to facilitate the launch of the first community resilience model training. Juvenile courts, we were very fortunate that some of our sector leaders and community champions were able to get us an audience with the chief judge of the juvenile courts. And we were able to give her a presentation, and she's actually very excited about training probation officers in Connections Matter and Darkness to Light. Our goal is to get the school resource officers in Clayton County Public Schools trained in the same way. But what we're super excited about is sort of breaking into the faith community. Now, with the faith community, it's highly nuanced. If you want to move the needle in the Black community, you got to hit the churches. Churches are where messages are promulgated. Churches are where movements begin, and churches are where movements end. There's very few main movements that have any major impact in our community that did not have a base or a foundation in the faith community. So we recognize the need to make sure that we had the faith community engaged. Next slide, please. So we developed an engagement strategy specifically around entering into the Black church. And we were very fortunate. In the past few months, we were able to now partner with the Clayton County Ministers Association, Restoration Theological Seminary, the Forest Park Ministers Association, and the Metro Atlanta Ministerial Alliance. We're putting together a sort of orientation for the leaders of those institutions who have all agreed to promulgate these trainings within their respective churches. So the idea now is we will train whole swaths of churches at one time. We would like to engage youth pastors, youth leaders, but one of the things that we are also recognizing in terms of a sector that has not been engaged, and I'll end on this, is youth and families themselves. We want to create spaces as a part of our model, now that we have leaders engaged, to give voice and agency to parents and children as well. And so super excited about the opportunity to work with Resilient Georgia and these amazing organizations across the state. And I just thank you for the opportunity.
Thank you so much, Javon. And there was a lot of people commenting about the Dr. Satcher quote, and I've heard you say it before, and it's just one of my favorites. And I always learn something after meeting with you. So thank you very much.
Thank you. Thank you so much.
Next, we're going to hear from Resilient Northeast Georgia and Meredith Lysott, who's the project manager with the Athens Area Community Foundation. And Meredith has just done an amazing job of bolstering the work being done in her region, as well as adding several new counties to her region. So she's going to talk a little bit more about their partnership with Family Connection Collaboratives. Meredith?
Perfect. Thank you so much for that introduction, Emily Ann. As she said, I am Meredith Lysott. I am the project manager at the Athens Area Community Foundation, who is administering our Resilient Northeast Georgia Trauma Grant. So to give you guys a quick overview of exactly who Resilient Northeast Georgia is, we are a coalition of 12 counties, and those are Clark, Barrow, Jackson, Oconee, Oglethorpe, Madison, Morgan, Walton, Newton, Jasper, Elbert, and Greene counties. Now, our primary partners on this grant are, as I said, the Athens Area Community Foundation, Georgia Family Connection, Region 5, and the Athens Wellbeing Project. And we're really working together to increase our regional collaborative efforts, reduce the duplication of services, and streamline our innovative and action plans as we move into the communities. So to give you a quick overview of what we've done in the first 6 months, we've really worked to build a coalition that is built on our partnerships in the region. So we've worked to establish our presence within the region through our partnership with Georgia Family Connection. And as I know most of you on this call who have presented already have worked with them, they are such an incredible partner. They both know their communities, they're connected to their communities, and they are just so engaged in doing this work. We genuinely would not be as far along as we are without them this year. But as a part of that, we've really worked to bring cross-sector trainings of youth mental health first aid and community resiliency model. We've co-hosted a Second Chance Employment webinar series. We're planning for a DEI summit at the end of August, and we also planned and executed a regional trauma summit, which I'll talk to you about in just a minute. Next slide, please. So I'm going to kind of work backwards and talk to you guys about our impacts first. So at the end of June, we were able to work with our Family Connection partners to plan and execute a day-long summit that we called Stronger Together, Building a Trauma-Informed Northeast Georgia. So at that summit, we brought together 151 attendees from across all 12 counties in our region. That really also represented all 12 sectors of the Resilient Georgia Roadmap pretty equitably. And that also represented 65 different organizations from within our region. So looking at some of the outcomes of that day of learning together, we saw a 27.4% increase in people's understanding of trauma, a 34% increase in people's understanding of resiliency, a 319.4% increase in people walking away feeling more connected to other people within their region doing similar work. Additionally, we saw a 657.7% increase in people walking away feeling confident that they had new or enhanced strategies for doing this work within the region after spending 6 hours together. And finally, we saw a 796.9% increase in people feeling that because of their work with others in the region, they had tangible next steps to go out into their communities to bring trauma-informed work and practices beyond their own organizations and to continue to partner with us as Resilient Northeast Georgia. If you're interested, we have the rest of that data report there. You can access it with that QR link, and it's also linked on our website. But we saw a lot of really good numbers coming out of that day. Next slide, please. And really and truly, it is because of our partnerships. It's the strength of our partnerships with our family connections that made it possible for that data to be coming out of a single day event. And just looking at who's on the call today, I see that I think 10 of our 12 counties are represented by our family connections. It is so great to see that engagement and see that the folks who are so key in doing this work are here to see all of this happen today. So, hey, everybody, I can't see you individually, but I know you're here and that's great. So looking into our partnership strategies in year 3. So we did double in size from years 1 and 2 to 3 and 4. So we've really set time to plan to create a common language that was implemented into each of those 12 counties' strategic action plans. So there is a common line item across 12 counties that says that we are committed to doing trauma-informed work. We are committed to doing similar strategies across all 12 counties, and that's been kind of a huge win in our eyes from that partnership perspective. Another thing that we've done has been focusing on qualitative listening sessions. So I've spent time going out into each of the 12 counties, meeting with the coordinators, meeting with people who are doing the work, and really getting that baseline data on capacity, resources, strengths, what's available in each community that we can crosswalk together in these efforts as a region. Next, as I mentioned before, we hosted a collaborative summit, and it really truly brought together the region in a way that we haven't seen in a little bit with this work. So it was great to have everybody together learning and finding out what we're going to do next as a coalition. Next, we've spent a lot of time with the counties and as a region planning, talking, gaining consensus, and really figuring out what our impact is going to look like and how we're going to get there. And that really comes through a data-driven lens that is so bolstered by the evaluation and data prowess of the Athens Wellbeing Project, who is really helping us to collect that data and measure our impact as we go. And then finally, it's been through presence at the peer-to-peer network meetings. It's been really great to have that opportunity to every month get together with the coordinators from each family connection and listen to what they're doing in their counties, what they want to see next, and what we can plan on together. Next slide, please. So Resilient Northeast Georgia, we believe that when we are successful as partners, we are 3 things. We are strategic, we are sustainable, and we are specialized. So looking at that strategic element, we believe that the creation of this common language that is reflected in the strategic action plans across all 12 counties has really made a strategic impact in how we talk about trauma, how we work together on trauma, and how we make sure that we are really reducing that duplication of services and efforts across the region. In such a large region, there's bound to be things that kind of cross over, and we believe that working as partners in this is really going to move us forward rather than just seeing a duplication of services over time. Next is that consensus of aims. We work together to find 5 aims and a whole bunch of sub-aims that really represent the work that we want to do here as a region, and gaining consensus across all 12 counties and across all 12 of our family connection partners has been huge in solidifying our strategies moving forward. And then finally, we have worked to strategically deliver evidence-based services that are targeted to the 12 sectors of the Resilient Georgia training map, and also to the needs and focuses of each of the 12 counties. So for example, in Morgan County, we worked with the faith-based community to bring a youth mental health first aid training to folks in churches who are working with youth on a daily basis. And that's been something that has been so great to see that impact strategically take place. And that's just one of the many examples I could talk to you about today, but in the interest of time, I'll keep it brief on that. Second, sustainability. The work that we've done has been grounded in the trust and the knowledge of our family connection partners. It has really been so crucial to not only get to know the communities and the coordinators, but also to have a trusted partner there that can get us connected to other resources and other people willing to do this work. It's really helped us to grow this coalition as we move forward. And that has also helped with our capacity building efforts. So we've really focused on how we can build the capacity of all of our partners so that, heaven forbid this grant ends at some point, we have that infrastructure laid down, ready to go, that will continue to carry us on moving forward. And then finally, that looks like supporting existing and emerging efforts. And this has been a huge pillar of the work that we've been doing, is really reviewing the strategic action plans of each of our Family Connection partners, seeing what work they're already doing and seeing how we can support that work moving forward. So I'll give you an example there. I know Walton County is really strong in the youth-focused sector of things. We really want to help to bolster their youth-centered work and also take that focus regionally as we move forward. Finally, we believe that we are specialized. So the way that we see it is regionally inclusive, but county specific, meaning that everyone is doing things together, but there are bits and pieces of that regional strategic plan that are specific to each one of the counties there. So everyone sees themselves included in the regional outlook, but also sees something that is happening for all 12 of us together as we move forward as partners. And really that is, again, bolstered by the knowledge of the Family Connection coordinators and organizations that are so established and trusted in their communities. It's been so great to see how we can really leverage them as the wonderful leaders that they are to move this work forward. Next slide, please. So in the interest of time, I wanted to give you guys a Google poll because this is a slightly longer question, but we'd really like to listen to you all as people who are also working within the trauma-informed space to see what trainings or models you all are familiar with that you would recommend to us as a coalition that we can use to bring to our partners as we continue to grow and expand as a coalition. So again, that is, what trainings or resources have you used in the past or would you recommend to us as we move forward? And I'll give you guys just a minute to scan that QR code or grab that link, but that would be super helpful to get your feedback as fellow experts in this field. And in the interest of time, I will go ahead and move on. Next slide, please. If you want to learn more about the Resilient Northeast Georgia Coalition, you can visit our website here, or scan that QR code. And if you have any questions, if you have any follow-up, that second QR code will be an email linked directly to me. I would love to hear from each and every one of you. Let me know if you have any questions, comments, whatever you got for me. I'm happy to have it. But again, thank you all so much for your time today. And it's been such a pleasure to present here today. Thank you.
Thank you so much, Meredith. So I'd just like to take a minute to thank everyone for being here today. I hope from the presentations you can see how all of our grantees and regional partners have really created different communities of learning and have continued to learn from each other. And we want to invite everybody to be part of this work. So if you have any follow-up questions or sidebar asks that you'd like to follow up with Resilient Georgia on, I think all of you have my email address since I sent you this invite. Or you can always email info@resilientga.org and we will get information out to you. We will send a very in-depth follow-up document from this meeting. All of the presentations are already on our general meeting webpage on our website. And then two more quick things I wanted to share. One, we have created a statewide advocacy page on our website. A lot of you had emailed us and were very curious about exactly what House Bill 1013 or the Mental Health Parity Bill did. We've compiled all of the different cheat sheets and documents that kind of showcase what that work is and what it does. So it's available for anybody to use, and a lot of our partners put those things together. So that is available on our website, and Audrey put it in the chat. And lastly, we have also worked very hard. Meredith reminded me, I didn't mention this at the top of our meeting, to create learning cards. We will co-brand those with anybody that would like to co-brand them. They are currently translated in Spanish and Portuguese, but in the near future, we will have 10 different languages available on our website. So we're very, very proud and excited about that. They're easy to print, easy to share, and those are in the chat as well. And again, you can find them on our website under learning cards. So thank you all for being here today. I hope you can make time in December to join us when we'll hear from our other 8 coalitions that cover the other 77 counties that we're currently working with. And I hope everybody has a great afternoon. And for all of those of you that have started school today or in the past week, I hope it's a good day for you and all of your children and loved ones. Have a great day. Thank you.
Bye. Thank you, guys.